So hello viewers, welcome once again to my YouTube channel and in succession to the videos what I have been taking up in general medicine. So today's topic of the discussion is about the insulin and when are its indication and what are the complications of insulin therapy. So as you all might be very well aware that insulin is required for the proper control of diabetes. So actually there are certain patients where insulin therapy is indicated, and it is mostly seen that in certain situations most of the times the doctor is going to recommend for diabetes the oral hypoglycemics. So the oral hypoglycemics, they are the drug of choice in most of the diabetic patients, but there are certain situations where insulin needs to be taken in the form of an injection. So such patients are particularly in cases such as when the oral hypoglycemic drugs are failing, so that becomes necessary for the patient to take injectable insulin. Apart from, there are certain pregnant women who are suffering from gestational diabetes and whose diabetes cannot be controlled through diet, so they are also administered insulin through injections. Apart from this, in conditions of diabetic ketoacidosis also, these insulin therapy, insulin in the form of injections is needed. And apart from this, it is very importantly that there are two types of diabetes. One is the non-insulin dependent diabetes mellitus and the other is insulin dependent diabetes mellitus. So in situations of insulin dependent diabetes mellitus, there are certain situations when the person has to undergo any kind of a surgery and his blood sugar level is not controlled. So for preparing the patient for any kind of a surgery which is to be conducted in general anesthesia, so insulin injections are given to such patients to control their blood glucose level before performing their routine surgery. Now basically these are the 3, 4, 5 indications what I have said, that in conditions of gestational diabetes, to control the pregnant women's blood glucose level, which cannot be controlled by diet in conditions of diabetic ketoacidosis. Apart from this, in patients who are having the insulin dependent diabetes mellitus, and in preparing the patients for any kind of a surgery what needs to be conducted under general anesthesia, and if their blood glucose level is not getting managed by oral hypoglycemic agents, then injectable insulin needs to be administered to such patients. Apart from this, this is a very important indication when the oral hypoglycemics are going to fail. So in such situations also the doctor can ask the patient to get injectable insulins to control the abrupt rise in the blood glucose level. So there are certain complications when the first time the patient is going to inject insulin. There can be certain complications what can be seen in some of the patients, and they are very temporary, they fade away as the insulin is taken for a long period of time. When it is continued later on, such reactions, they occur transiently and after that they may not happen. So this video will be discussing about the complications what are associated with insulin therapy. The first very important complication is the hypoglycemia. So there are certain cases where the patient is injecting the oral where the patient is injecting the insulin injections inadvertently. So once there is inadvertent injections of this insulin, so ultimately this can lead to hypoglycemia, and even if the patient is going to miss a meal after getting the injectable insulin or performing several exercises after getting insulin, so such a situation the patient can have the patient is going to have this kind of a complication of sudden hypoglycemia. Apart from this, there can be certain local reactions as well. So at the injection site one may find that there is swelling, there is erythema, and sometimes a stinging sensation where the injection of the insulin is being given. So the patient might feel a certain kind of a stinging sensation. That stinging sensation is there. Apart from this, if a particular site is being injected with insulin, that site may even show lipodystrophy, that is, there can occur disturbance in the fat metabolism of that particular area. So these are the complication is the hypoglycemia, and next complication it is the local reaction, what is seen in the form of erythema and stinging sensation, and even the swelling can also appear at the injection site. Apart from this, we have certain kind of an certain patients, they are very allergic to insulin injections, and this can be due to certain kind of contaminated proteins. So in certain situations there can also be found that there are certain rashes, which in medical terminology it is called as urticaria. Apart from this, there can be swelling of the internal blood vessels, they can swell up, which is called as angioedema, and this angioedema can be without rashes or it can accompany along with the rashes. Apart from this, there can be various other manifestations such as swelling. So in certain situations there can be swelling of certain the body parts, also the short-lived dependent kind of a swelling can also be seen, and this short-lived dependent edema, with when insulin therapy is started, in certain patients it is seen. Apart from this, the condition of anaphylactic reactions. So when the body's anaphylactic reactions, the body can also show after an insulin injection. So viewers and students, this was a very short discussion where I have summarized in a very short form the complications of insulin therapy. So in the professional exams, you can be asked about the complications of insulin therapy. It can be in the form of hypoglycemia, it can be in the form of local reaction to a particular site, it can be in the form of a swelling, it can be in the form of an allergy. So such symptoms needs to be monitored for the first time when the patient is getting insulin. These symptoms needs to be monitored, and if there is any kind of these complications are occurring, they need to consult to their healthcare professionals. So students and viewers, this was a very short discussion where I've tried my level best to give you the indications of insulin therapy, where injectable insulins can be given to the patients, and what are the complications that can arise due to insulin therapy. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.